Okay, we're going to go ahead and get started. And hello, everyone. I want to thank you today for joining us to talk about telehealth. My name is Jeff Donnell, and I'm president of Enterprise Health, and we really appreciate your time today. We know everybody is incredibly busy as we all respond to the coronavirus pandemic. And even though today's webinar is about telehealth and video conferencing, you'll be glad to know that I am not going to turn my camera on due to my stay-at-home work shaving habits. So I will spare you all from that, and instead we'll look at slides on the screen today. Our plan is to keep today's session short and sweet. We're going to try to keep it to about 30 minutes, and then we will gladly stay on the line as long as you want for Q&A. And just a few housekeeping items. We are recording today's session, and we'll be able to provide you with access to the recording either later today or early next week. We've also muted all attendees on entry so that we limit background noise, but we can certainly open up the lines later on when we get to Q&A. But note that you can pose questions via the chat feature of WebEx, and then we'll keep track of those questions and address those at the end. And speaking of WebEx, we have occasionally noticed some performance issues with this platform, just given the sharp rise in virtual meetings in the last few months, but hopefully that's not going to affect us today. Again, we really appreciate you all registering to attend today's session. We looked at the registration list, which was well over 100 folks. We've really got a good mix of current clients as well as prospective clients, partners, other interested parties. And we really want to thank our clients who registered today, including folks from Eli Lilly and Company, Chevron, Corteva Agriscience, Marathon Petroleum, Berkeley Lab, Procter & Gamble, Prudential Financial, Bristol Myers Squibb, Dow Chemical, Citgo, Emory, Phillips 66, and Boston Medical Center. So thanks to all of you for attending today. And I know many of our clients already know us very well, but we are going to take just a minute or two to provide everybody else with just a little bit of quick context on our organization before we actually talk about telehealth. So I'll start with the obligatory elevator pitch. And Enterprise Health is the only cloud-based health IT solution that combines occupational health and compliance, clinical care, and employee engagement on a single interoperable certified electronic health record platform. And our focus is on equipping our enterprise clients and their employees for a healthier future. We work primarily with employers who operate their own on-site employee health clinics, and that includes Fortune 1000 organizations all over the world, hospitals and health systems who are providing employee and occupational health services, as well as government agencies. And in most organizations, we encounter two different domains. There's the environmental health and safety group, and then there's corporate health and wellness function, which is often part of human resources operations. And we find that most of our clients tend to view employee health as a continuum. So as we've built out our platform, we've done so to satisfy a wide range of occupational and employee health requirements. And that ranges from occupational health and compliance, like medical surveillance, management of worksite injuries and illness, case management, regulatory compliance, to the provision of primary and urgent care services, as well as chronic disease management and health and wellness programs. And our software as a service application is built out to provide the comprehensive technical infrastructure that our clients need to manage, document, track, streamline, and report on employee health. And just a little bit about security. Ours is a web-based software as a service application, as I said, that we host. And we do that in a secure HIPAA-compliant environment. And our data center environment is SOC 2 Type 2, high trust, and NIST cybersecurity framework certified. Okay, so with that as context, let's talk just a little bit about telehealth and really the things that kind of drove our development in this area. And telehealth was actually already on our development roadmap, and a number of our clients here in the last year or so have identified this as an area of interest. And really, originally as a way to provide health services to remote employees or to operations where they don't have on-site clinics. However, with the advent of the COVID-19 outbreak, that immediately rocketed telehealth to the top of our priority list. And a number of our clients made it clear they needed a way to see employees when their clinics were closed, and most of their employees were working remotely. They needed that overnight, and at least the initial focus is around COVID-19 employee monitoring. So our development team conducted what amounted to a 72-hour sprint. They took the work that had already been done, really focused on working quickly to finish that work out. And we had an initial version ready to roll out literally in a couple of days. And we have a few clients who've actually been using telehealth for several weeks. And we've made a number of rapid refinements already based on their experience and their feedback. And as we've rolled this out, we've gathered a couple of insights from our client community using the product. And first and foremost, they made it clear this has got to be easy. Before we rolled this out, we heard stories of people trying to use things like FaceTime. But not everybody has an iPhone, and if you do something like FaceTime from your own phone, now your employee has your personal phone number, which is not necessarily ideal. We also heard that people were trying to use things like Zoom, but they found that employees were struggling to download, set up, and use applications like this. And then, of course, you've got stories going around about that phenomenon known as Zoom bombing, where uninvited guests are joining a video call and they're sharing not safe for work images that really don't instill a lot of confidence in using this approach. So we knew it had to be easy to deploy, it had to be easy to use, and we also knew that our clients had a wide variety of use cases and varying workflows. And this applies certainly to managing COVID-19 monitoring and preparing for return to work management, but also longer term uses of telehealth. So rather than viewing telehealth as a magic bullet, our approach is that we're integrating telehealth into our platform to build incremental value. And again, we look for a very simple way to insert telehealth capability seamlessly into an already robust workplace offering. So let me just give you a little background and context for the demo. We're actually going to conduct the demo from what is called Channel 19. And that is a standalone COVID-19 employee monitoring application that we introduced just a couple of weeks ago. And ever since this pandemic started to take off and we really started working on this back in January, we've been working very closely and collaboratively with several of our clients over the last couple of months. And we've taken already existing pandemic response capability and existing functionality like medical surveillance, case management, encounter documentation, employee engagement functionality, and we've configured that specifically to help our clients respond to COVID-19. And we realized that much of this effort could actually apply to any employer trying to monitor employees and prepare for return to work. So we carved that functionality out, set it up as a standalone application. But it's actually just a constrained version of enterprise health. So we've taken our core product, we've turned about 98% of the capabilities off. So if you're an enterprise health client attending today's webinar, this demo is going to look a lot like what you're used to, just with far fewer tabs and functions. But certainly if you're an existing client, we can take the telehealth capabilities that you're going to see, and we can quickly and easily deploy those and integrate them into your existing workflow. Also, today's demo is going to focus on COVID-19 monitoring because that's top of mind for everybody. But of course, telehealth can be applied far more broadly. So with that as context, what I'm going to do is I'm going to turn things over to Angela and Daisy, and they are going to actually conduct a brief demo. Okay, Daisy, you should have control.
All right. So the first thing that we want to do is just show you how quick and easy it is to start a telehealth visit from an employee chart. And then after we do that, we will go through the entire workflow from start to finish. So the first thing that I'm going to do is I'm in the employee's chart that I want to connect with. And up at the top of the chart, you'll see these two buttons. And by clicking this first button, it is going to send a text message and an email to the employee to let them know that they're ready to be seen in the virtual room. And that email and cell phone number is going to automatically fill from what is in their demographics on file. If I needed to last minute just come in and change this, maybe someone's cell phone is dead today and they need to use something else, you can come in and edit that. This is also a message that will be sent via text message to the employee. And you could come in here and also edit this, add additional information if you needed to. I'm going to leave it as is for right now. And I'm just going to click send invite. Then I'll get these two messages up here to let me know that the text message and the email went through successfully. And that's going to look something like this for the employee. They'll receive a text message with that same message and a link embedded in that text message. The link will, by clicking on the link, that will take them directly into the virtual room. They do not need to install any software. They do not need to download an app or anything like that. It just goes directly inside. The only thing that they will need to do is allow access to their microphone and camera so that we can hear and see them. And if they accidentally hit cancel or deny, then it will tell them that they need to go ahead and allow those two to go through so that they can use the functionality properly. They will also get an email, and this is helpful if they want to use a computer instead of their phone. And you can use a computer. A laptop is a really good example if it already has a camera and a microphone built in. If they wanted to use a different type of computer, that's fine too, but it just needs to have a camera, so like an external webcam or something like that. But the same concept applies. They just need to click on this link, and that will also take them directly into the room. No software, no downloads. So back in as the provider in the system, if I'm ready to see my employee, I come back up to my two buttons up here and just click on the video visit. A new window is going to pop up, and it's going to show me and my patient. We're going to end this for now, and then I'm going to kick things over to Angela, and she's going to show you the start of the workflow and what it looks like for the employee.
All right, so I am the employee, and in this scenario, I'm going to show you how I'm going to log on to the employee portal using my single sign-on. I'm going to report COVID symptoms, and I am going to self-schedule a telehealth visit. So the workflow starts with the employee. So I log into the employee portal, and I see I have a symptom monitoring questionnaire that I can fill out. So some of the information will pre-fill in if I've filled this in before. So I'm going to go through and answer some questions here. I'm going to report that I have a fever, a cough, sore throat, congestion and body aches. Has lasted for 3 days. And I'm going to submit my questionnaire. Now this questionnaire can be customized, whatever information you want to gather, however you want to configure that questionnaire. So, and I made some of those fields required as well as indicated with the red asterisk. Next, I'm going to click on my appointments, and I'm going to schedule an appointment. So schedule new appointment, and I can choose telehealth visit for my reason. This is automatically going to schedule with the first available provider. You can configure this if you want to have a drop down to select a provider. This is actually reading the schedule availability live. So you can set this out if you don't want same day appointments. You can set it out to start reading tomorrow. So as an employee, I'm going to say COVID symptoms need seen, and I'm going to select submit. Now, once I select submit, I'm going to get an email confirmation, and I'm going to show you what that looks like. This email confirmation here will go to my email, and the message in the confirmation can be customized as well. So as a patient, my side is done. I went on the portal, I filled in that I was symptomatic, and I scheduled my own appointment. So now I'm going to hand it back over to Daisy because she's going to play the provider part, and we're going to continue the visit.
Okay, so back when I signed back into the system as the provider, I'm taken to my COVID-19 landing page, and this has several different sections in it called portlets, and the portlets just allow you to quickly navigate to different spaces of the system. So the ones that we have available right now are chart search, so you can do it by name or employee number, for instance. any recent charts that I've been in, my schedule for the day, and the COVID-19 monitoring work list, which I'll talk about again here in just a few minutes. So my schedule for the day should show any appointments that I have at this location and under this resource. If I wanted to add additional locations or additional resources, I could do that here as well, and it would list their appointments and what time they're at. So Annabelle, I have an appointment with her today, so I'm just going to pop into her chart. And in her chart, we have additional portlets here. So we have the demographics, a quick link for my encounter, any allergies or medications that the employee has reported, a quick medical history, and then the most recent vitals that have been recorded. So Angela recorded that she had 101 temperature on her portal questionnaire, and so now we can see that that is listed here under vitals and the date that it was reported. So I'm ready to start my encounter, and I can come up here to my quick links, and I have two options. One is the illness screening, and then the other is the virtual illness screening. They're essentially the same thing, but we separated them out so that you could tell historically and for record-keeping purposes which encounters were done face-to-face in office versus which ones were done via telehealth. If you don't want to separate these out, that's okay. We don't have to do that for your particular company. So today, since I'm doing a telehealth visit, I'm going to open a virtual illness screening encounter just by clicking on this link. Once I'm in the encounter, I'm going to see several different sections for you to document different types of things. Also at the top are some quick jump buttons. These allow you to just quickly navigate to the sections you need of the encounter without having to scroll through. Also, this particular encounter is set up for a more standard clinical setting, but if you are someone that works maybe in HR or more for an administrative role that would be utilizing this, we can set this up to work better for you by either changing what's listed here underneath each of the sections. All of this is completely customizable. We could also add additional sections. We could take away some sections. We can also just change the name of all of the sections as well to something that would be more meaningful for you. Under my questionnaires header, I do see any questionnaires that have been submitted by the employee on their portal within the past 60 days. So we can see the symptom survey that Angela just filled out on the portal here. And if I click on this button, it'll open up a new window, and I can actually go through the symptom questionnaire in its entirety. If I want to leave that open while I finish my encounter, I can just come back over here to my other tab. Or if I'm done looking at it, I can just X out, and that will bring me back to my encounter as well. So now that I'm ready to actually start my visit, I can come up here again to my button, and I can send a text message and an email to let her know that I'm ready for her to be seen. Again, I'm going to get my pop-ups to let me know that those were successfully sent. And then once I'm ready, I can just open up my video visit. So now my patient's here. You can move this around. You can do a split screen. If you have two monitors, you might want to move it over to another monitor. You can also just minimize it and go and keep talking to your patient as you go through your encounter, which is what I'm going to do today so that we can see the entire encounter. So we're going to go ahead and get started with our visit. So Annabelle, could you go ahead and verify your date of birth for me, please?
5/31/77.
Great. I see that you filled out a symptom survey on the portal. When did those symptoms start for you?
Well, my cough started 3 days ago, and I just started a fever today.
Okay. Do you have any symptoms that you weren't able to report on the questionnaire?
I've been really tired.
And have you taken any medications for your symptoms, such as like cold medicine or Tylenol, Advil?
Tylenol and also vitamin C.
Okay. And have you had any recent contact with someone who has a confirmed positive COVID test or anyone that's been sick?
Well, my neighbor has been tested, but we haven't got the results back, and I do go over there and take care of her animals.
Okay. Well, based off of that, I am going to go ahead and refer you to your PCP to get COVID testing. I am also going to take you out of work for the next week. If you get your results back within that week, please make a follow-up appointment on the portal or call the office and let us know what those results are. Especially if it's positive, we may need to take you out for a little bit longer, and we'll need to let your supervisor know. In the meantime, please keep taking your Tylenol for your fever as needed, increase your fluids, and if you get worse, please make a follow-up appointment with your primary care physician or maybe urgent care. Do you have any questions for me?
At what point, would if they say it's positive, at what point do I call you or do I call my PCP?
You can call your PCP too, but make sure to let us know so that we can document it and then we can coordinate when you should come back to work.
Okay, and do I need to talk to my supervisor and let her know?
You do not. We will go ahead and send her an email and let her know that you'll be out for the next week.
Okay. Thank you.
All right, thank you. I hope you feel better.
Thank you.
So as I said previously, this section that I was documenting in is completely customizable. We can change the questions, get rid of the questions, add additional, or if you decide you don't need this section, we can take it out completely. We also have a section here where we're just capturing some information about COVID testing, and this is also customizable. If it's a telehealth visit that you're not doing for COVID, you might find that this is something that you don't even need for that particular encounter, and that's fine too. Under plan narrative, we do have a text box here for you to be able to just free type any notes that you have from the visit, but we also have what we're calling macros or dot phrases, and these are also completely customizable for your system and even on an individual basis. So anything that you find yourself typing quite often, you can set up a macro for it. And they work simply by just doing a .b and hitting space, and then it'll put in that information for you. You could do it for just a letter, or you could do phrases, whichever makes more sense to you. If you're more of a mouse person, you can also just come over here and click on what you would want to enter into the note. Since I told her to go to her PCP and to follow up with us in a week about those test results, I'm going to notate that here and let her know that I need to follow up in a week. It's just kind of a reminder to myself. And I can set my follow-up date for a week here. And then the next one is restrictions, and this is where I can actually take her out of work. So I'm going to pick lost time COVID. But if you are taking them out of work for a different reason that doesn't have anything to do with COVID, you can just do it as regular lost time. And I'm going to say that this is affecting work. The start date is going to auto-populate for me, and I'm going to pick my end date of next week. After I hit save, it'll display that I have an active restriction up here for her, and this is actually going to send an email automatically to her supervisor to let them know that she will be out of work for the next week. If she were to call back and tell me that she's positive or she's still having symptoms and we feel we need to keep her out of work for a little bit longer, we can come in here and edit this, and then her supervisor will receive another email to let them know that it's been modified. So since I want to follow up on this encounter and I want to come back and enter in some results about the outcome and her test results and things like that, I'm going to save this as an incomplete encounter, and I do that by coming up to my virtual illness screening button up here and just clicking that. Then I'm going to go back to my COVID-19 landing page, and under the COVID-19 monitoring work list, we can see now that Sanibel is on my work list. It shows that she had a virtual illness screening, that I need to follow up with her on the 24th, the last time that she self-reported on the portal, that she has a pending COVID test out, and that I took her out of work until the 24th. If she were to call me back or set another appointment and I need to make further notes on her encounter, or I need to put the test results in, I can click this link to start the encounter and it'll take me right back into that exact same encounter. The other thing that we have in the system is the COVID status page. And this is just a quick dashboard of some information that we're capturing related to COVID in those encounters, such as lost time, the testing outcomes, how many workers that you're monitoring, and the recovery outcomes. So that concludes the demo portion of things, and I'm going to flip things back to Jeff.
Okay, thank you, Daisy and Angela. And I have to applaud Angela for actually even throwing in a couple of coughs there at the end.
Hey, Jeff, that was my acting. That's the best I can do.
Fantastic.
Thanks.
Very, very impressive. Okay. So I just want to summarize a couple things. And obviously there are a number of different benefits here. And we can rapidly deploy this solution, again, either as an add-on to an existing enterprise health build, or it's an option for the Channel 19 standalone application that we just rolled out. And the good news is we've actually been able to get our existing users up and running on telehealth literally within a day or two. And as you saw, there's absolutely no software for the employee to install. They simply get a text or an email, click on a link, and use the camera and microphone that's already embedded in their phone or their computer. And what we tried to do is make this as easy as possible for both providers and employees. And as you saw, with 2 clicks, you can send an invite. With 1 click, you initiate the visit. So there's very little effort on either part. And we've set this up so that we integrate telehealth right into your workflow. So you can use this capability in conjunction with things like employee portals, different encounter types, different use cases. I also want to point out that we are continually innovating on telehealth. I mean, we just rolled it out, but we're already adding additional functionality. For example, we're going live, I think today, with a feature where you could easily invite additional people to a video visit. So maybe you want to pull in a family member, maybe pull in a supervisor to talk specifically about restrictions and accommodations, or maybe even pull in an external provider. We're also building out artificial intelligence capability because these audio or video visits can be recorded, but then we're also building in the ability to automatically transcribe the recording so that you've got that. And again, we're trying to make it just easier to conduct the visit and really streamline things. And as our clients use telehealth and suggest additional enhancements, we're going to continue to upgrade the offering, based on real-world feedback. Also, this is all managed in a HIPAA-compliant infrastructure. We want to make sure that the data and the recordings are kept safe and secure. And, here with the coronavirus pandemic, a number of restrictions on telehealth technology have been lifted, but we know that those are temporary. And we think it's important both now and in the future to make sure that we're securing protected health information and that we're doing so using really best-in-class healthcare security guidelines. We've also priced this so it's a very affordable solution, and we'll share pricing information with those who are interested in learning more after the webinar. I think it's also important to note that, while we accelerated the launch of telehealth, did this very quickly to respond to the current pandemic, there's really no doubt that the Telehealth Genie is now out of the bottle. We're seeing providers in physician practice and hospital settings have really embraced telehealth, and right now out of necessity because, in large part, they can't see people in office settings. And some of the longstanding roadblocks that have really been around for decades that have kind of hampered telehealth kind of fully flourishing, those roadblocks have been cleared almost overnight. So, as we start to get back to business as usual or whatever the new normal ends up being, we know that in-person visits will come back, but telehealth volumes are without question going to be higher than they were before this pandemic. And in the employer space, once COVID-19 dies down, we know that telehealth is going to be a great way to provide services to employees who are out on the road, people who work remotely, or your employees who operate in work locations where an on-site clinic simply is not available. And telehealth is a really affordable alternative for all kinds of different visit types. Things like routine return to work visits, case management follow-up, health and wellness counseling. And if you think about, in many cases, you might have to send those remote employees or employees who don't have access to an on-site clinic, to a third-party provider for those kinds of visits. But now you could have company clinic providers able to do those sorts of things, and that just further enhances the value of your on-site clinic operations. So in closing, we see telehealth as a great way to conduct a video visit as part of COVID-19 response, and whether that's providing care and counsel to symptomatic employees, or what's going to become very important here in short order is helping coordinate return to work activity. But longer term, again, there are going to be all kinds of ongoing use cases for telehealth. And it is a good low-cost way to extend the value proposition of your on-site clinic operations and potentially reduce third-party provider spend. And we try to make this as easy and affordable as possible, both to deploy and use. You can add it to Enterprise Health or Channel 19 very rapidly. And if you're a client who's interested in learning more, all you have to do is contact your Enterprise Health account manager or support representative. And if you're not a client, our sales team is going to follow up afterwards. Or if you're eager to get going, just shoot us an email. We've set up a special email, channel19@enterprisehealth.com. I also want to thank the folks at the Institute for Health and Productivity Management for their support in helping us get the word out about this webinar. And also, I want to point out that we're planning a return to work webinar probably 2 weeks from today. We're just firming up the date. But what we're going to do is we're going to have a panel of occupational health experts, and that's probably going to be some members of our external advisory board and some of our clients, as well as somebody from the legal world. And we're going to have them talk a little bit about COVID-19 return to work strategies. And we all know this is kind of a moving target, but our aim is to at least share different approaches and algorithms that various employers are developing and deploying to manage return to work. And we also will talk a little bit about some of the legal and ethical issues that are involved. So be on the lookout for more information for that. But again, we want to thank you all for joining us today. And we will stay on the line to respond to questions. And what we would suggest is that if you have a question, use the chat function in WebEx. Because the last webinar we did when we opened up the lines and unmuted everybody, unfortunately, we still got a lot of background noise and it was almost impossible to hear. So I think what we'd love to do is see, if anybody has, put together some questions through the chat functionality.
Yep, Jeff and Emily, we've got a couple of questions. I'll read them off for you here. First question is from Dr. Amir Wolf. Can we access this from our work phone and then quickly link to a virtual illness screening? And yes, you absolutely can. We do want to speak with you, Dr. Wolf, about any security limitations that you guys impose on mobile use, just to make sure that we're playing nice with that. But it's completely browser-based, so you can certainly access it from Safari or whatever browser you use on your phone, and you could conduct your visit completely from your cell phone. So if you're traveling or, just not sitting in front of the computer and need to do something on the go, you should have no problems with that whatsoever. Again, barring any limitations that your company might impose on use of yourself, so we can talk through that with you in more detail. We also have a question about the security provisions for data transmission, and we're more than happy to share that with you. Full disclosure, I am not the right person to answer those questions, and I don't know that we have a technical person on the line for the demonstration today. So Jeff, we can follow up with some additional information and maybe disclose, the security protocols and things that are in place for, where that data is stored, if it is recorded or anything like that. So we'll certainly follow up with some more information on the security specifics.
Yep, absolutely. And again, this is all part of a HIPAA compliant telecom infrastructure. And as we do this, of course, we'll execute a business associate agreement, which we have in place with most of our clients anyway. Yeah, we have far more detail that we can share on kind of the security and privacy protections that are in place.
Wonderful, thank you. Another great question about using this as a business case for assessments on new hires. And actually, yes, that is a great use case here. We actually showed today how an employee could access the portal, and certainly most, medium to large corporations these days use single sign-on for access to just about all of the applications that they use. But we actually offer a one-time use portal. We call it our applicant portal. So if you have someone who's not on your network yet because maybe they're still going through the hiring process, they can actually get access one time by just entering their information. It does not create a user for them to come back, but they can initiate that visit with you on a one-time basis so that you can go through that new hire process, and it works very well. And in that case, using the applicant portal, you can do the same type of questionnaires that you saw Daisy complete, or I think Angela completed them, where it's collecting certain information. She was obviously collecting COVID-related information, but you may want to collect, very different information about an applicant and maybe their respiratory history if they're going to be using a respirator or things like that. So we can build those out for you or even show you how to build them. It's actually relatively simple. So yeah, that's a great use case and something that we do have people doing at this point.
Yeah, what I'll do, I'll go ahead and we'll take a chance and unmute everyone.
What version of EHS do you have to have for this added functionality to be in?
Right now, you do need to be on an environment that we host, and it needs to be on 2019-09, I believe, or newer. We'll do our best to be flexible there if we need to get some functionality patched back, but right now, it's something that if you're having us host your data in one of our pretty typical environments, that we can stand up on 2019-09 in about a day.
Great, thank you.
Again, we really appreciate everybody's time today. Thank you all for joining us. We will get follow-up out no later than Monday morning with a link to the recording as well as a copy of all the slides. And again, if you have more questions, want to learn more, either just reach out to us, either call your normal contact at Enterprise Health, send an email to channel 19 at Enterprise Health, and then we'll also be following up as well. So thanks everybody. Have a great weekend. Stay safe and be well.